Today at ONSALUS, we will explain why you might have a lump in your stomach. A lump between your ribs and stomach can be caused by many things, such as hernias, fatty tissue, cysts, among others. The symptoms can be mild or severe and may include abdominal pain, nausea, vomiting, and diarrhea. So, let's explore what are its most common reasons. Number 1. Lipoma. Lipomas are lumps of fat that grow slowly under the skin. They are harmless tumors and can be found anywhere on the body, including between the ribs and stomach. Lipomas can be of different sizes, from very small to quite large. The cause of lipomas is not fully understood, but they are more common in middle-aged people and people who are overweight or obese. Lipomas usually do not cause any health problems, but large lipomas can be painful or limit movement because they press on nerves or have many blood vessels. How to treat it? Those lipomas that cause pain and limit the person's mobility are usually removed through liposuction or surgical extraction. Number 2. Hiatal hernia. A hiatal hernia is when the top of the stomach pushes through a hole in the diaphragm. This can cause food and acid from the stomach to flow back up to the esophagus. A small hiatal hernia may not cause any symptoms, but a larger hernia can cause heartburn, indigestion, bloating, chest pain, burping, and difficulty swallowing. You may also feel a lump between your ribs and stomach. Hiatal hernias are more common in people over 50 and in smokers. They are caused by pressure on the diaphragm, such as from obesity, chronic coughing, constipation, or heavy lifting. How to treat it? If a hiatal hernia causes symptoms, there are treatments available. If you have heartburn, your doctor may prescribe medication to reduce acid production. They may also recommend a low-fat diet and eating smaller meals more often. Number 3. Abscesses. Abscesses are pus-filled pockets that are usually caused by a bacterial infection. They can form in the stomach, between the ribs, in the pelvis, near the liver, pancreas, or other organs. Abscesses can also be caused by a burst appendix, abdominal surgery, a perforated ulcer, or inflammatory bowel disease. Abscesses appear as lumps of different sizes. They can be seen on ultrasound and CT scans. Most people with abscesses have severe pain, fever, and feel unwell. Other symptoms may vary depending on where the abscess is located. These symptoms may include nausea, loss of appetite, and weight loss. How to treat it? Treatment for abscesses include draining the pus and giving antibiotics. The type of antibiotic used will depend on the type of bacteria that is causing the infection. Drainage can be done by inserting a needle and flexible probe into the abscess or by surgery. It is important to remove the pus as quickly as possible. Antibiotics are also used to prevent the infection from spreading and causing serious complications such as sepsis. Number 4. Abdominal eventration. Abdominal eventration is a type of hernia that occurs when the abdominal wall does not heal properly after surgery. This causes a hole to form in the wall and the abdominal contents can push through. There are a number of things that can cause abdominal eventration, including obesity, poor nutrition, and complications during surgery. Abdominal eventration usually appears as a lump or tumor on the abdomen, where the scar from the surgery is located. It can cause pain, inflammation, and fever. How to treat it? Abdominal eventration is treated with surgery. The surgeon may use a mesh patch to reinforce the abdominal wall. If this video is helping to answer your questions, remember that you can collaborate with the channel through a super thanks. Number 5. Mesenteric cyst. A mesenteric cyst is a rare benign tumor that is filled with fluid and tissue. It forms in the abdomen near the small intestine. Depending on its size, it can be located between the ribs or take up a large part of the abdomen. The cause of mesenteric cysts is not fully understood. They are thought to be caused by a blockage in the lymphatic ducts, birth defects, surgery, or pelvic disease. Symptoms of mesenteric cysts do not usually appear until the tumor or lump grows large enough to cause severe pain in the abdomen, nausea, vomiting, and constipation. How to treat it? Mesenteric cysts can be treated with aspiration and partial resection of their contents. This means that a needle is inserted into the cyst to drain the fluid, and then part of the cyst wall is removed. However, there is a chance that the cyst could grow back. Number 6. Xiphoid process of the sternum. The xiphoid process is a small bone at the bottom of the sternum. It is where the abdominal muscles and some ligaments that help us breathe attach. Lumps in the xiphoid process are not common. When they do occur, they are usually cancerous and involve other nearby organs. They are more common in older adults and men. These tumors can grow to different sizes and may not cause any discomfort until they are advanced. When they do cause symptoms, they can include chest pain, abdominal pain, fever, chills, swelling, and breathing problems. How to treat it? Treatment for xiphoid process tumors is complex. Usually the doctor will recommend surgery to remove as much of the tumor as possible. Number 7. Stomach cancer. Stomach cancer is when cells in the stomach grow out of control. It can start in the middle of the abdomen, below the ribs, or near the connections between the stomach and esophagus. It usually doesn't cause any symptoms at first, but as it grows, it can cause stomach pain, vomiting, black stools, feeling full after eating small meals, weight loss, and fatigue. There are a number of risk factors for stomach cancer, including chronic gastritis, smoking, and family history. How to treat it? The best treatment for stomach cancer depends on the type and stage of the cancer. The main treatment options are surgery, chemotherapy, radiation therapy, and immunotherapy. Surgery is used to remove the tumor, part of the stomach, and nearby lymph nodes. Chemotherapy and radiation therapy may be used to shrink the tumor or kill cancer cells. Immunotherapy is used to help the body's immune system fight off cancer cells. Well, that's all for this video from ONSALUS Health about why lumps appear between the ribs and stomach. Please remember to like this video and leave your questions or suggestions in the comments below. See you next time.